When you have chronic pain or chronic illness, navigating your treatment options can be very overwhelming. And one thing that I noticed when I was going through my chronic illness journey was that it felt like there were two main camps. Western medical options over here, and then you had more alternative medicine or alternative health options over here. And you might find yourself bouncing between a lot of different doctors and therapists and alternative medicine practitioners and becoming quite confused and overwhelmed as to what is actually good for you. And really, the real problem isn't what you choose, it's losing control over your own health journey and your own body. Now, I'm going to be speaking very much from my personal experience and experiences that my clients have told me about. I know that this is not everybody's experience, but I've heard it enough times that I really felt like it was important to talk about. So in this video, I'm going to be talking about how to tune out some of that noise and how to start to listen to your own inner voice as to what really is best for you, so that you can take all of the information and make an informed decision that is actually in your best interest, rather than letting everybody else make your decisions for you. When I had chronic and very severe eczema, I felt like I was constantly being ping-ponged between these two camps. So on one hand, I had the Western medicine camp, for lack of a better word, but the Western medicine camp sort of saying you can use creams and take these medicines. And then in the other camp, there was a lot of like, you should be doing cleanses and doing this diet or using this supplement, blah, 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 coming from like sort of the alternative medicine camp. I found myself being constantly pushed and pulled between the two camps, and I got so overwhelmed and confused that I went down some not so safe and healthy paths because I was desperate and I was scared. So I started my journey very much just following what my doctor always told me: use these steroid creams and you'll be right. But when the creams stopped working, they didn't really have much else to offer me at that time. And I lost confidence that they really could help me at all. So I went to the other camp, and there were a lot of options. I tried Chinese medicine with like herbs and acupuncture and all of that. I tried a lot of interesting detoxes, and I tried quite a number of diets and supplements out the wazoo. I tried a lot of different things. But the thing that I noticed was when I was trying the creams and talking to my doctor and going to dermatologists, I would ask them like, hey, is there anything else that I can do? Like, you know, is there anything in my diet that I can change? Or is there a supplement that I can take? And they sort of poo-pooed and was like, oh, no, like it has nothing to do with that. And the only thing he could offer me was, here's a steroid cream. So you can kind of understand why I was a bit like, well, thanks, buddy. I'm gonna go over here now. And so I went over here, and they're like, yes, there's so much you can do. You can do this, and you can do that, and you can do this cleanse, and this diet, and this protocol, and this supplement, blah, 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 blah. But my symptoms were not getting any better. And something that I heard quite a lot, and I don't know if, I know that these people that I saw were meaning well, but I heard a lot of fear-mongering around medication. So they were like, oh, those steroid creams are really bad for you. They'll destroy your skin's microbiome. They'll cause like all these issues, and you're basically poisoning yourself. And oh, don't take that medication. And like, oh, this option is really bad because it'll cause you cancer, and it'll do this and it'll do that. And, you know, and you're not even treating the root cause of the problem anyway. And you really ought to be healing from the inside out and, you know, doing it the right way. That is a rhetoric that I heard so much. And so I really started to develop an aversion to anything medical. I was so afraid of taking any medications, to the point where I remember I had this really bad flare up, like my face just exploded. My eyes were like super closed up and squinty, and I couldn't really see properly, and I was a mess. And I actually had to go to the ER because it was so bad. And the doctor gave me prednisone, a steroid, like an oral steroid. And I flat out refused. I was like, no, I'm not putting that in my body. Because I had heard how evil these things were and how pharma was out to get you and how they just want to manipulate you and keep you sick and blah, blah. It was all very intense. And you hear that enough. You hear it again and again and again and again, and you really believe it. But then this, the Western side of things, like the medical options, weren't really any better because they would say, well, just take this medication. And that's it. That was it. That was all I got. For so long, that was all I got, was use this cream, here's some prednisone, off you go. And there was also a sense of like, oh, don't be an idiot. Take the medication, otherwise you're gonna get more and more sick. Your eczema is gonna get more and more out of control and there's nothing you can really do. I felt like I was stuck between like feeling like an idiot because I wasn't taking what I was supposed to take and feeling like I was betraying my body and making myself sicker by taking these medications. I was really stuck between a rock and a hard place. And it just became so loud and so noisy in here and so filled with fear and so filled with other people's voices telling me what I should do. And I completely tuned out what I thought. I turned to other people. I turned to voices on the internet, and I just desperately wanted someone to tell me what to do. And I was just scared. I was just really scared and really confused, and I made some really bad decisions based on some really bad advice. From both sides, might I add. And I think both sides use subtle tactics to try and control your decision making, and I don't think it's malicious. I think it is done out of a place of wanting the best for you and feeling that they have the best options. There are some subtle control tactics, and they may not even be from the individual that you're talking to, but there is some cultural things that go on both sides. And I want you to be aware of them and be aware of your choices and be aware of how to take back your sense of control and autonomy when you're dealing with any practitioner of any discipline. Something that I've noticed with more Western medicine is there is a sense of like, they are the expert and you are not. They know what's best and you should just trust them and do as they say. I feel from my experiences, there was very little room for back and forth conversation. And I've seen this when I've had clients come in and say, oh yeah, I've just seen a physio and they used so much pressure that I'm actually in more pain. They were doing a treatment that was so painful that it actually made me worse. I've had a massive flare up and I'm a wreck because of the treatment that they gave me. And I think that comes from a place of the client feeling like they can't speak up during the appointment. If the physio is doing something, they feel like they have to just put up with it. I have heard that story more times than I would like. And I've had it happen to myself where I just give over control because I'm like, well, I've come to this person, they are the expert, and I need to just shut up and put up, even if it's really painful, even if it's making me feel really uncomfortable. This is what I'm here for. And I think that's what makes alternative medicine so appealing, is that there is a lot of compassion and heart in alternative medicine. And that's part of what I love about it, is it is filled with people who quite often have been through a chronic illness or have been through pain, and they understand where you're coming from, and they understand the frustration of being sort of talked down to or let down by Western medicine. And I think that is one of the most beautiful things about it, is the care that you can find in alternative medicine. However, I do feel that there is fear-mongering and there is a sense of making traditional medicine an enemy. And that is not all practitioners, that is not all alternative medicine therapists. Most certainly not. But it happens enough, and it certainly happens online enough, that it's really important to talk about and be aware of, is that medication can be turned into the boogeyman, that it's this evil thing that's going to kill you, and it will do more damage than the illness itself. That right there, whew, that is something I heard so much. I do want everyone to be aware of the risks and the side effects of medication, but I think that the demonization of it that happens from the alternative medicine space is very detrimental and honestly kind of manipulative. I think that there is a subtle sense of we're better because we're natural. It's the appeal to nature fallacy. We're healing from the inside out. Therefore, we're not doing any damage. That is definitely something I bought into hard with the alternative medicine group, or I'm going to say wellness group, because I think wellness encompasses not just the very legit alternative medicine options, but also the more shady stuff that kind of happens on the fringes, which I definitely got caught up in. I think I did myself far more damage using some of those methods and protocols and supplements than I ever did using the drugs that I had to use to manage my symptoms. That is a story for another time. A good alternative medicine practitioner will not dissuade you from taking medication. They will talk with you about the risks and talk with you about the side effects and talk with you how to manage those side effects and discuss with you how you can best and most safely use medication with the support of alternative medicine. But I don't think any alternative medicine practitioner worth their salt will say that you shouldn't take something. And I think that they will put your interests above their own beliefs. There are a lot of people very invested in their own methods. We all believe that what we offer is the best thing. Hell, I think what I do is great, but I also know that it is not the only thing. And it is sometimes not the appropriate thing for certain people in certain circumstances. So how do you go about finding that inner voice and listening to it and setting your boundaries? Five top tips. There's probably heaps more than 5. First up, be aware of your boundaries. I think this is particularly important when it comes to physical therapy, whether that be acupuncture or physios, or hell, even working with a PT. You need to know what is acceptable for you, not based on what everybody else is doing or what other people tell you need to do, but what helps you feel comfortable and safe in a session. If a massage therapist or a physio or an acupuncturist or anyone who touches your body is making you feel uncomfortable, I would recommend having almost a script that you say. You know, if you're not someone who's comfortable with confrontation, and let's face it, not many of us are. I hate it. And it can be as simple as, oh, that's a bit much. Could you use less pressure? Or that's really painful. Can you find a different way? Could be something super simple, super short. And it doesn't have to be aggressive or angry. That person doesn't want to cause you pain. And if they do, that is a whole other problem in itself, and you should not go back there. That's probably another topic for another video, the fact that the physical therapy world does like to cause a lot of pain. But anyway, that's not the point. Most good practitioners are not going to want to cause you unnecessary pain. And you can tell what is good pain, what is pain that you can relax into, what is pain that feels productive and healthy, versus the pain that just makes your whole body seize up and makes you feel like you just want to crawl out of your skin. Yeah? The kind of grit your teeth and bear it kind of pain. That's not what you need to push through. And you're allowed to say that. Number 2 is know when to walk away when something's not working. I'm all for giving something a fair go and giving a method long enough to see if it's actually working. But I've had so many clients come to me and be like, oh yeah, I've seen that person for years and I never really felt like it worked. And I was like, good on you for your patience and your perseverance, but damn, like, you didn't have to do that. And I do think that there are some people who are really good at getting people to come back. And so if that person, if your practitioner is not referring you even after, say, months, it depends on method to method, but do your research, learn how long it should take to start to see results. And if you're not seeing them, look for someone else. Number 3 is more introspective, and it's to do with understanding where your decisions are coming from. So say for myself, there was a point, a long point in time when I refused to take medication. I refused flat out. I was just like, nope, that shit is evil. It's gonna kill me. And I don't want anything to do with the pharmaceutical industry because they're a whole bunch of lizard people who are gonna kill me and blah, 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 blah. Lots of paranoia. But I didn't see that. All I saw was I had very justified reasons and I was sticking to my guns. But I think if I had just scraped past the top layer just a little bit, I would have seen that I was just really, really scared. And that my decision making was coming from a place of irrational fear and fear-mongering that I had heard. And that my decisions really weren't coming from a sound place. I probably could have done with some counseling at that time. Alas, it was not meant to be. I stuck it out alone for a long time. But I think had someone led me to really look inwards and examine where my decisions were coming from, I would have realized that I was letting other people's voices inform my decisions. And eventually, when I did come to a place where I could think a little more rationally and think a little more clearly, I finally did come around to like, okay, it is time to take the medicine, but I'm gonna do it in my way, and I'm gonna do it in a way that makes me feel comfortable. Which kind of leads me very nicely into my next point, which is to ask questions. You're allowed to ask questions. Just as you're allowed to say no or to ask someone to change their approach so it's less painful, you're also allowed to ask as many bloody questions as you want. I remember that the thing that helped me turn around on my approach to medication was actually a doctor who just listened, who actually respected me enough to answer my questions and to say, yeah, this is scary. You're allowed to have a lot of questions. And I remember sitting down in her office and having like 5 pages of questions. And I saw her eyes go a bit like, whoa, shit. But she very compassionately and kindly answered all of them. And she wasn't able to say that there were no risks. There were risks to what I needed to do, but she explained how the risk was outweighed by the necessity. My body was falling apart. I was not in a good way, and I desperately needed to get these symptoms under control. But the thing that actually made me open to it was her humanity and her respect for me as a scared, confused young woman who I just needed someone to talk to me like an adult in that world. I don't feel like anyone had until that point. And I get teary every time I think about it. It's so, Anyway. The thing that she was able to work with was the fact that I had a lot of questions. She was able to answer them for me. Had I not asked any questions, she wouldn't have known to answer them. You know what I mean? Like, I went in there very headstrong, being like, all right, lady, you got me in this office, now answer my questions. And she said, okay. And I was like, oh, okay. I don't need to fight. Okay. That helped turn my attitude around so fast. All right, last point. Are we up to 4 or 5? I can't remember, it doesn't matter. Finally, you are in charge. You are in charge of your body and your journey and your decisions. It's not about ignoring everybody else, but when you put yourself in the driver's seat, you're then able to listen to everybody else a little more clearly. You get to choose which voices feel right to listen to rather than everything coming in all at once. I definitely don't want anyone to think that I'm saying, oh, just ignore everyone. No, because you're also not the expert. You don't have all the answers. There's going to be someone out there who's going to have just the right thing for you at this right moment. And when you're able to tune into yourself, you're going to be able to decipher what that right thing is. It all becomes a lot simpler and clearer. Maybe no less scary, and maybe no less still uncertain at times, but less confusing, less loud, less chaotic, and less easily swayable by every Tom, Dick, and Harry who has an opinion. And don't they have a lot of them? You know what they say about opinions? Particularly this day and age with the internet, is you can find an opinion on anything. Everyone's gonna offer their opinion if you ask for it. Learning to discern who to listen to is a very valuable skill in this day and age, and you can only do that when you know how to listen to yourself. Thank you so much. I really hope that this was helpful. I really wish someone had said this to me when I was in the middle of my journey, but then again, I guess that's why I'm making these videos. So I hope you gained something useful out of this video, and if you liked it, click like and subscribe and do all the things. I like talking about this quite a bit, and I will see you in the next one. Bye.